Well, welcome everybody. Thanks for joining us. I'm not sure we have anything all that new to offer you. I know everybody's following the COVID material pretty closely, but we've found it useful in the past to review what's happening and what our responses have been, and certainly have time at the end for any questions or comments. Next slide, Angela. So this is the situation worldwide. 100 million plus cases, 2.5 million deaths. In Canada, about 850,000 cases and 22,000 deaths. And in Manitoba, about 32,000 cases and approaching 900 deaths. The hospital numbers have been quite stable and slowly decreasing in the last few weeks. A total of not quite 200 people in hospital, 75 of which are still positive. A test positivity rate that has come down quite nicely. You'll remember that certainly we were over 10% for quite an extended period of time. We're down to 4.3% in terms of the province and 3.8% in Winnipeg. I would point out that the test positivity rate in Indigenous communities is still over 10% and has been persistent. We're under, of course, public health orders that were loosened a little bit a few weeks ago, and the next review of that is next week. On the last go-around, there was some loosening of access to restaurants, gyms, and retail shopping. And I think we all anticipate there'll be a bit of a further loosening with the announcements next week. Next slide. The issue now is really trying to sort out for all public health endeavors across the world, what's the balance with reducing case numbers and the risk of what are now being called variants of concern. We've been pretty lucky in Manitoba so far. Only 5 of the UK variant have been reported and have not clustered and certainly not shown any community spread. But of course, there are mutants from South Africa, Brazil, Denmark, and as of yesterday, a new variant arising from New York that looks a bit worrisome. So the variants are really getting attention in the public health world. We're seeing some, because of the risk of increased transmission, we're seeing some changes in terms of how you define close contact and for what period of time. That used to be 2 meters and 15 minutes. It used to be of continuous exposure, then that became of accumulated exposure, and that has now been reduced to 10 minutes as they define whether or not you may or may not be a close contact. And of course, the self-isolation requirements have changed and increased from previous periods to 14 days. We are seeing the vaccines starting to pick up in terms of their arrival and then distribution. We are seeing the first opening to the general public this week for individuals over 95 years of age, and that, of course, will work down the age groups. We have seen quite a bit of variation across the country in terms of that public opening. Manitoba having the highest bar at 95, other provinces functioning at 75 and 80. There's now increasing discussion, no decisions yet in Manitoba, of the efficacy of a single dose and how that efficacy appears to be such that the delay of the second dose may be much more acceptable than certainly the on-label requirements. So we may see some changes there that would increase the availability to the general public. The other change that Pfizer, who initially required -80 freezer storage, which made it a little less transportable, has changed their requirement to just regular freezer requirements or regular freezer temperature and maintenance. And that does open up the use of Pfizer in some more rural or even some of the large isolated communities. So we may see some changes in distribution of those vaccines. As of today, AstraZeneca was approved in Canada, but the arrival of that vaccine is still going to be delayed until later in the spring in terms of any particular volume. The Janssen vaccine and the Novavax vaccine are still being reviewed, but once again won't come on stream, even if approved, until later in the spring. We've had about 90 cases across the university. About half of them, a little more than half, have been in our faculty, mostly, almost entirely in medicine and nursing, where the clinical exposures have been the most remarkable. It's been quite interesting that despite what you'd think would have been significant clinical exposures, the dentistry has had very few cases. Most or early on, all of the cases were being brought into the faculty in the clinical realm, frankly, from social interaction, and more recently in medicine and nursing. Some of those cases have actually been from clinical exposures. Now, we have looked to our students to participate in supporting the COVID efforts. There's been a call around requiring inoculation supports or vaccinators. We've had 300 students sign up to participate, and they are slowly being brought onto the payroll of Shared Health. We've had some confusion around capacity for Med 1 students to participate. We think they're eligible as they've been trained. Shared Health has been a little more confused about it, but we hope to have that clarified soon. There is a training requirement for everybody vis-a-vis the information system use, and we will see, I think, increasing draws on these student vaccinators as the vaccine supply increases and the sites expand. Now, we're having some interesting discussions that have not been finalized, so this is tentative at this point, where Ngomazin may be requested to manage the vaccination program for all of First Nations communities and neighboring communities in Manitoba. It amounts to about 126 communities. If we were finally asked to confirm that, we will be requiring 300 to 400 vaccinators to participate, and we'll once again be going to both our student and faculty bodies to see if people would be willing to participate. So you may see a call as early as next week for interest. The commitment does come with the potential to be vaccinated prior, of course, to engaging. And we are looking at ways that perhaps we could provide our own vaccination site for our own staff and students. There will be probably some minimal requirement of participation of something like 8 or 10 days of activity, not all at once, of course, but spread out over the next 3 or 4 months. As I said, this remains tentative, but it would be great for people to start thinking of their interest or capacity to participate. We will be tracking students and their immunizations for COVID-19, which is what we do with other immunization requirements as well. And we do expect self-declaration of students about their status. And of course, that status may influence future capacities around clinical care as we move forward in this pandemic. Next slide. Now, as we've seen the public health orders loosen up, we have seen some changes at the university. So the Neil John McLean Library opened about a week ago or a little more for use as a study facility. The Joe Dupe Recreation Center reopened with, of course, limited utilization. Tim's Coffee on the main floor has reopened, and we have continued to make study spaces available for Rady students within our buildings and capacity. We've opened up lunch spaces in the Brody Center. We have, frankly, had some difficulty from time to time and have needed to issue some reminders about the use of masks, the importance of social distancing, and have found some students tending to cluster without masks, as of course they just long for social contact and getting to know their classmates. So that has been an issue, and we continue to monitor. We do screen still, and we'll be reassessing our screening probably with the next announcement coming from government. But there is after-hours access for Brody, Apotex, and dentistry with card swipe. There's also BS, Basic Medical Sciences building access from HSC, so we allow our clinical colleagues to be able to go back and forth. There is tunnel access with swipe cards. We have improved the parking access to students, especially for after hours, so that they have less distance to walk and find it more comfortable. And the university is charging us a low flat rate for parking now for staff and faculty. I think it's $10 a month from the regular 80 plus. Now the college deans meet generally weekly. We've reduced that in the recent past to bi-weekly to go over these issues, as there's lots of detail that always pops up, and requests for changes and exceptions to rules, and we deal with them as they come in. We do also meet regularly, and this is largely through Raman with directors, managers, and administrators to make sure everybody's up to speed about what's happening at the dean's meetings. And we do continue to communicate through our communications group to make sure everybody has an understanding of where we are. We also, of course, report regularly on the Rady COVID-19 website, which is kept, I think, quite reasonably up to date. Now, the budget has not yet been through the board, but we are anticipating a 1.75% budget cut to the university budget from government. There will be a limit to tuition increases as well. And the tuition increases last year, and I think this year, will be tied to the Canadian Western University averages by college. So if there are tuitions that are roughly consistent, the tuition increases are lower. If there's a gap between our tuitions and those of Western universities, then the increase in tuition is higher. We've also accumulated, partly because of the incapacity to travel, a fair number of carryover vacation banks. And we're now working through that issue to try to work consistently with all those with vacation banks to ensure that this doesn't become a future deficit. So there will be an allowance for carrying a certain number of days forward, but otherwise there's an expectation that the vacation will be used in this fiscal year. Next slide. We've had some interesting discussions and once again a fair bit of confusion with Shared Health around mask fit testing for N95s. Of course, the dilemma is that there are many types of N95 masks at different institutions, and they all require fit testing before being allowed on those wards. Because of the huge draw around fit testing and the use of PPE because of COVID in the clinical structure, we were having trouble getting our students fit tested, which will allow them to function clinically, and had to, in effect, take a contract with an external source to fit test 1,300 Rady students. We heard just this week, finally, from Shared Health that they are willing to continue to fit test medical students in Med 3 and Med 4 because they see them as employees, but are not willing to fit test students from other clinical programs and colleges. So we are beginning to explore whether we either contract that out to make sure we get it done in a timely way, or in fact purchase the equipment required for fit testing, and then perhaps seeking other students to administer the fit testing in exchange for pay, of course. So those things are still being worked out, and we should be coming to some conclusions in the next few weeks. As the risks of the variants continues to cause concern, we have increased the requirement in clinical skills settings to level 3 medical masks, and everyone else must wear 3-ply masks or medical grade masks at a more junior level, level 1, at all times except when eating or drinking. Now, this causes some confusion in vocabulary because people get mixed up between level 3 and 3-ply. So the 3-ply just means there's 3 layers. The level 3 has a much higher rate of filtration and are much more consistent in their management of aerosols. So we'll continue to monitor the issue of variants and how they're impacting on spread, and we'll upgrade these requirements as we go along. There's also been an increased requirement to move to face shields to replace the light goggle eye protection that was previously supplied, and we are working to acquire those for distribution. Now, although we've had a relatively modest number of cases, we have had over 300 students requiring COVID testing and self-isolating, which has put some strain on winter terms and graduation dates in some of our programs. And those requirements have been extended by the university to try to accommodate those stresses. Once again, we're expecting, and in fact, the summer term will be delivered remotely with some minor exceptions. And we've now received approvals for all of the summer activity for our faculty from the university processes. Next fall term has not yet quite been determined, but I would anticipate that large group teaching will continue to be virtual. We might see some extension depending on the COVID numbers around small group teaching. So as I mentioned, there's now a 14-day self-isolation period required for any travel outside of Manitoba. And prior to that, it was only east of Traverse Bay and south. And it now includes travel from the west. We've paused all PGME electives until the end of March, and we'll review once again based on COVID numbers and other OTPT and other out-of-province placements have been paused and are being looked at on a case-by-case basis. There are occasional exceptions. We've had someone who has been off and living in Kenora, and we are allowing in those circumstances to have clinical placements where they're living that will receive credit here. We've worked hard to increase our capacity around communication. We, in fact, in the end, hired the Occupational and Environmental Safety and Health Group from Shared Health to take the lead on our students because we did not have an internal capacity in terms of providing advice and follow-up and surveillance for our positive cases and for our exposures. So they continue to provide screening of all our students who went off because of testing or self-isolation. And I think that's gone very well. And it's positive to report that the number of folks requiring testing has dropped pretty dramatically after Christmas as we've seen cases come down. So I think that that's a positive and hopeful sign. Now we are, of course, we've had research restrictions. That's early in the COVID experience was almost a complete shutdown. It's been slowly increased from 20 to more recently 30% to ramp up research. And we have made a request to central administration that as numbers, if they stay down for sure, that we'd like to see a further ramp up to 40 or 50%. So that's now being considered. And we have increased the requirement for level 1 medical grade masks and face shields in research labs, which we have provided, and reinforced that the compliance is the responsibility of the PI and department head. So we've seen very good compliance. We've heard recently there's a bit of resistance to the face shields because of visual disturbance, working in small spaces and with equipment. So we'll be looking at that, but at this point, that remains the requirement. Students are increasingly interested in coming to study and to use clinical spaces for practice skills. All of these activities have to be approved by a central steering committee of the university, who within that have 4 committees on operations, research, education, and health and safety, I think are the 4. And these requests from our faculty have largely been approved as long as they are supervised, that we have students monitoring themselves, and that we have the names of all students participating and documented. And of course, they go through a self-screening before being able to attend. Next slide. Lots of work to try to support the fact that people are working from home. We've recently transitioned to Office 365, I think university-wide. We've been offering both Microsoft Teams and Zoom to try to support the transition. Teams is no cost to us. Zoom has been relatively expensive. We've purchased about 500 licenses and have distributed them throughout the faculty. So we will be assessing whether Teams can be used. There's, of course, like everything else, whether it's computers or apps, there are folks that are devoted to Teams and folks that hate Teams and will only use Zoom. So we're going to have to work our way through that because it is not inexpensive. We've also been purchasing ExamSoft to support remote exam delivery and the monitoring of exams. That's worked effectively, but there are other programs used by the university that may also be needing to be considered. So we've been at this for a year. The fall looks like, to me at least, it's going to continue. I think we're going to find a real balancing between the impacts of a potential third wave that may or may not be led by the variants of concern and the rate of vaccination. We'll continue with a mix of in-person and remote teaching. Large group sessions, I'm pretty sure, will remain remote for now. And interestingly, I think this is not an issue just of the fall. I think this will be a broader discussion moving forward over the next several years of what is the mix of remote and in-person teaching that we will promote. Certainly, we've learned how to use, and people have adapted remarkably well to remote teaching, but there are also some concerns and disadvantages with it. The masking and cleaning measures may change as will be dictated by numbers. We'll be monitoring that closely. And as I mentioned, our own screening may need or may possibly be reduced if numbers continue to remain stable or fall. We know how hard this has been on everybody. I think everybody's exhausted with the degree of isolation and how this interferes with normal social function, and to an extent how it interferes with the work that we do. So I think it's been remarkable that we've done so well and that all of our students and faculty and staff have continued to adapt remarkably, and we've continued to provide, I think, an excellent service to students. And although we've seen our research struggle a little bit because of lab capacity limits, we hope that will increase throughout the summer and fall and allow more normal experiences and exposures. And I think that's the presentation. We're very happy to have any questions or comments. And I think we've got some numbers up there, or certainly the chat button or the hand button on the Zoom will respond to.
So I had a few questions sent in via text. So the first one was, are U of M patient-facing research staff who regularly visit HSC or St. Boniface for research allowed to receive the COVID-19 vaccination now?
I didn't quite catch the first part.
For researchers who are patient-facing and who go to HSC or St. Boniface to conduct their research, are they allowed to receive the COVID-19 vaccination now?
I don't think anybody has decided that researchers who are seeing patients, and even that has been quite limited, would yet be seen as qualifying for vaccination. So far, it's been limited to workers initially with direct exposures to patients, and then more recently, anybody in healthcare has really been included, but I don't think a decision yet has been made on researchers who may interact.
Next question. What is the current protocol regarding return to work for administrative staff? Or is there mandated return to work for administrative staff now or in the near future?
You know, I haven't heard any. I know it's being considered now by HR. What will happen as numbers remain stable, and what is the expectation? I don't think a decision has been made. We know that once again, there seems to be a split of those who would prefer to keep working from home for either personal or sense of safety reasons, and those that can't get back to the office fast enough to try to normalize how they work. So I don't think a decision has been made, at least certainly not one that's been shared. And we'll certainly keep everybody informed as that begins to roll out.
One more question. Do staff now all have swipe access into Brody once again?
I think anybody who's asked for it certainly has access to swipe access.
Okay, that's all the questions that were texted in or on chat.
Any other questions or comments?
There's a question in chat. Any idea where the 1.5% cut is going to come from?
No, the budget hasn't been approved yet. So we are, as we've done in the last several years, we'll be trying to look at what can be absorbed centrally, and we'll do as much of that as we can through, many different processes. And there may be some residual that needs to be passed on to colleges and departments. So that's not yet determined, but our effort will be to minimize that amount.
Okay, I think that's everything, unless anyone else has any more questions. Nope.
Okay, well, thanks everybody very much for attending. If there are questions in the future, feel free to let us know. And we will continue to endeavor to keep you updated as more information becomes available. Thank you very much.